Okay, this is a Castbar framework for a patient who has undergone lower arch full arch rehabilitation. For this patient, there was conventional implants placed some 8-10 months back. It's all on 4 technique followed, and 4 conventional implants placed in the premolar region on both the sides. But after 6 months, these implants failed. So afterwards, I asked the patient to get the CBCT done. According to the CBCT measurements, I could find a very less bone in the molar area on both the sides. So in the anterior, I could get some 16 to 17 mm. So what I planned was for the anterior polished surface bicortical screws I have placed. So that is you can see here 1, 2, 3, 4, 5 bicortical screws are there. So on the posteriors in the molar region, that is beyond the second molar, I have done buccal bypass. So that is have angulated up to 25 to 30 degrees and placed 2 implants in the 4th quadrant and 1 implant in the 3rd quadrant. So all these implants in the posterior region beyond the second molar are buccally bypassed and angulated and towards the ramus of the mandible. That is the direction in which I have placed the implant after osteotomy. So you can see now. So after the placement of the implant, zig trial was done. Then the implant excess was removed. Abutment excess was removed. Then my technician has fabricated this beautiful Castbar. So this Castbar usually if there is a single Castbar in the full mouth cases, what happens, the path of insertion sometimes will be difficult because we place the implant angulated in basal implantology. We do bend the implants later on to the occlusion. Till then we may have undercuts, all those things. So for that case, if there is a single framework bar, it's difficult to place, insert and to remove. So for this, I have advised my technician to cut this Castbar into 2 pieces so that it's easy for easy insertion. That is, a path of insertion and removal will be easy. So in the patient mouth also. So this is 2-piece Castbar framework, that is the lower arch. So you can have a look. You can have 4 implants here. This one anterior implants I have angulated. It crossed the midline also. I'll show it in the OPG. These 2 are placed beyond the second molar and they are bypassed buccally. So there was not much bone in this molar area on both the sides. So you can have a look here. Okay, these are the Castbars. This is the 3rd quadrant Castbar and this is the 4th quadrant one. Okay, so for easy path of insertion and removal and also in the patient mouth, we have cut this Castbar into 2 pieces. So I'll place it again. Okay. It's been placed again. Advantages of Castbar fabrication and fixation is that so it will help in the overall implant stabilization in the arch. So all implants will be together and all implants are connected with the Castbar so that they are stable. So the implants in the between the implants there won't be any micro movements. So it is always better you fix in full mouth cases, you fabricate the Castbar as early as possible, so that once you place the implant and after the placement of the implants, once the zig trial is done, so ask your technician to get the Castbar done within 1 or 2 days. So fixing the Castbar will help the implants to avoid micro movements and all implants will be bind together in a stable position without movement. So that is the use of the Castbar. If you fix the Castbar, once you fix the Castbar, then the problem will be less. So there won't be any micro movements, and these implants will not move at any cost. Even though you have the stability, good stability and anchorage, it's better to fix the Castbar as early as possible in full mouth cases. Okay, so now the next procedure will be, I'm going to fix this Castbar in the patient mouth. So I will just try it in the patient mouth and fix this Castbar with any luting cement. Usually you can go for a dual core resin cement, although it's because it's a less it will dissolve in water. So this cement is water repellent, so that you can use dual core resin cement for fixing, or otherwise you can go for any kind of good luting cement. So after fixing this Castbar in the patient mouth, check for the occlusion with the opposite hand. You take one more impression. So that is, after fixing the Castbar, you are going to take the impression, that is with the putty. You take the impression with the putty, then you apply the light body into this putty impression and take this impression again. You just place it in the patient mouth, and with the light body you take the impression again. So and send this work to the lab, so along with the lower upper cast. So upon this Castbar, you have to take one wax bite also for to check the occlusal height, all those things. So that prosthetic part I have explained it in other video also. So what the technician going to do after this is, he is going to fabricate whichever you have suggested him, maybe the zirconia processes or PFM processes or hybrid denture. For this patient we are doing the postally fused to metal processes. He gave a zig trial, he is going to give that is a bisque trial he will give of the PFM processes. This bisque trial, what we are going to do, the bisque trial will give a 80 to 90% almost the work will be done in the bisque trial, only the glazing part will be left out. So in the bisque trial, what we are going to do, we will check with the shade match along with the size of the teeth and how it matches with the patient's face appearance, all those things. After checking all this, and main proper important thing is the posterior occlusion. So after checking all these things, we will send back this bisque trial back to the lab, where the technician will glaze it and polish it and give it back to you. The next day you can fix these processes in the patient mouth. So here I have explained about the Castbar fixation, the importance of Castbar fixation and the prosthetic part in full mouth rehabilitation cases. Thank you.